In 1989, our governments passed an all-party resolution to end child poverty by the year 2000. Since then, the number of children living in poverty has increased by about 40%. Almost 1 in 5 Canadian children still lives in poverty. Poverty is making our children sick. You should feel blessed that you don't have to rely on emergency food banks to feed your family. That bread and peanut butter that you wished your kids would eat less of is sometimes all that a low-income mother has left from her last trip to the food bank. Imagine being her, and your 5-year-old son is allergic to peanut butter. So all you can give him is plain bread. How healthy would that be? What would you do in her shoes? When your little girl is sick, there's nothing you wouldn't do to make her better. But stop and think what it must be like for a father on minimum wage when his little girl is sick. He often has to depend on free drug samples from hospitals. And what if the samples run out? Imagine being that father and unable to afford the medicine your little girl so desperately needs. All you could do is pray that she gets better on her own. What would you do in his shoes? You're facing one of those life-altering decisions. One of you must either stay home to care for your chronically ill child, or you must hire a private nurse. Whatever you decide, at least you can afford to have options. But for low-income working parents, what do they do when someone is chronically ill in their family? Who quits when neither can afford to? Imagine being them. What would you do in their shoes? As a high-risk expectant mother, you're going through a really hard time, with all the seemingly endless complications you've had to deal with. Thank God for your drug plan and paid sick leave. But consider what it's like for a low-income working mother with no drug plan, no sick leave. What if she's high risk and needs the same expensive medication? What does she do? Imagine being her and having to deny your baby its best chance at a healthy start. What would you do in her shoes? These are some of the stark realities many low-income Canadians face each and every day. Imagine what you would do in their shoes. Poverty is a major cause of poor health in children. Is poverty a condition we can live with? She can't. It's time to do something about it.